Now, let's study the different heart murmurs in detail. We will go one by one. In systolic section, first we will discuss aortic stenosis. Aortic stenosis produces a crescendo, decrescendo, systolic ejection murmur. It is loudest at the heart base, and the sound typically radiates to the carotids. On auscultation, you may also hear a soft second heart sound, S2, and sometimes an ejection click. A classic finding is pulsus parvis et tardus. This means the arterial pulse is weak and delayed in its peak. Aortic stenosis is most commonly caused by age-related calcification of the aortic valve, typically in patients over 60 years of age. In younger patients, it is often due to early-onset calcification of a bicuspid aortic valve, usually around 50 to 60 years old. Aortic stenosis can lead to the classic triad of syncope, angina, and dyspnea on exertion. These three symptoms are often remembered with the abbreviation SAD. Hemodynamically, the condition produces an increased left ventricular pressure compared to aortic pressure during systole because the narrowed valve obstructs outflow. Mitral and tricuspid regurgitation. Both mitral regurgitation and tricuspid regurgitation produce a holosystolic, high-pitched, blowing murmur. For mitral regurgitation, the murmur is loudest at the apex, and it radiates toward the axilla. For tricuspid regurgitation, the murmur is loudest at the tricuspid area. For mitral regurgitation, it is often caused by ischemic heart disease after myocardial infarction, by mitral valve prolapse, by left ventricular dilatation, and by rheumatic fever. For tricuspid regurgitation, it is often due to right ventricular dilatation, and it may also occur as a secondary complication of permanent pacemaker placement. For either mitral or tricuspid regurgitation, both can be caused by infective endocarditis. Mitral valve prolapse, also called MVP. Mitral valve prolapse produces a late crescendo murmur with a mid-systolic click. This click occurs after the carotid pulse. The murmur is best heard over the apex of the heart, and it is loudest just before the second heart sound, S2. Most cases of mitral valve prolapse are usually benign. However, it can predispose patients to infective endocarditis. Causes of mitral valve prolapse include rheumatic fever, chorditendinite rupture, mitral annular disjunction, and myxomatous degeneration, which may be primary or secondary to connective tissue disease, such as Marfan syndrome or Ehlers-Danlos syndrome. The mid-systolic click is due to sudden tensing of the chorditendinite as the mitral leaflets prolapse into the left atrium. The chorditendinite are responsible for producing the crescendo murmur that follows the click. Ventricular septal defect, also called VSD. Ventricular septal defect produces a holosystolic, harsh-sounding murmur. This murmur is loudest at the tricuspid area. Ventricular septal defect is a congenital condition. One important point to remember is that larger VSDs often produce a lower intensity murmur, whereas smaller VSDs can actually produce a louder murmur. Now, in the diastolic murmurs section, we will talk about aortic regurgitation. Aortic regurgitation produces an early diastolic, decrescendo, high-pitched blowing murmur. It is best heard at the base of the heart, in cases of aortic root dilation, or at the left sternal border, in cases of valvular disease. The causes of aortic regurgitation can be remembered with a mnemonic BEAR. B stands for bicuspid aortic valve. E stands for endocarditis. A stands for aortic root dilation. R stands for rheumatic fever. Aortic regurgitation is associated with a wide pulse pressure. You may also detect a pistol shot sound over the femoral artery and a pulsing nail bed sign, also called Quincke's pulse. Other features include a hyperdynamic pulse and head bobbing when the regurgitation is severe and chronic. Over time, this condition can progress to left-sided heart failure. Mitral stenosis. Mitral stenosis produces a murmur that follows an opening snap. It is a delayed, rumbling, mid to late diastolic murmur. The interval between the second heart sound, S2, and the opening snap, OS, correlates with the severity of the stenosis. The shorter the interval, the more severe the disease. Mitral stenosis is a late and highly specific sequela of rheumatic fever. Chronic mitral stenosis can lead to left atrial dilation and pulmonary congestion. Complications include atrial fibrillation, Ortner syndrome, which is hoarseness due to compression of the recurrent laryngeal nerve, hemoptysis, and eventually right-sided heart failure. The opening snap occurs because an abrupt halt in leaflet motion during diastole. This happens after rapid opening due to fusion at the leaflet tips. Hemodynamically, the left atrial pressure is much greater than the left ventricular pressure during diastole. In the continuous murmur section, let's talk about patent ductus arteriosus, or PDA. Patent ductus arteriosus produces a continuous, machine-like murmur. It is best heard at the left infraclavicular area. The murmur is loudest at the second heart sound, S2. PDA is often due to congenital rubella infection, or it can be associated with prematurity. A helpful way to remember it is the phrase. You need a patent for that machine. This connects the idea of a patent ductus arteriosus with a machine-like murmur that it produces.